Using different acne treatments can sometimes be similar to killing an insect with a shotgun. Overkill. The best acne treatment first is understanding, number one, what type of acne that you have, and number two, what types of acne ingredients work best for your particular type of skin. Sometimes too many acne control ingredients can absorb too much oil so that your skin is now over dry because you're using too many oil control products, or you have just a few pimples and you are prescribed antibiotics or Accutane, or you come in with too many blackheads or too many papules and pustules and they prescribe you a very strong antibiotic. They could be overkill. Generally speaking, grade 1 acne is considered non-inflammatory, which means you don't see a lot of red. So you can see some blackheads, some whiteheads, some papules, some maybe just a few pustules. But for the most part, it's non-inflammatory, and that is grade 1. It's sometimes confusing because sometimes people can have really shiny or what would we consider greasy skin, and other times you may not have very much oil at all, but there's still some pimples that exist. Typically for this type of skin, it's usually a desquamation issue, and desquamation basically means the speed at which the skin cell turns over. So what's happening is that if it's mostly flesh colored bumps, then what's happening is the dead skin cells are being trapped in the pores, causing the flesh colored bumps. Sometimes they'll have red bumps, and when you try to squeeze them, there's no pus. Other times, pus comes out later. So it just depends. So when it's this type of issue that you find that you are having, then what you want to do is you want to look for acne control ingredients such as salicylic acid, which is a beta hydroxy acid. And that one helps with the skin cell turnover rate, and it helps dry out the pimple, or if it's a flesh colored bump, it actually prevents more of that from happening, and it also really helps blackheads. The other one is glycolic acid, which is an AHA. It's an alpha hydroxy acid. And basically that is small enough to go in and basically, they're both keratolytic agents, but basically it goes in to eat between the intracellular cement that holds the dead skin cells together. So they are basically speeding up skin cell turnover rate, and that addresses the flesh colored bumps and sometimes the red bumps. So in this case, when you have very few pimples on your face, sometimes people are prescribed Retin-A or some type of retinoid. This, I think, is overkill. When you have that few pimples, you can easily go and get something over the counter. Because for some people, when you don't have any inflammation, there are just a few pimples, and you use Retin-A and your skin, it can sensitize the skin, just like glycolic acid. But typically when you're getting glycolic acid in a product over the counter, it's a lot lower percentage. So I really don't recommend using Retin-A when you have just a few pimples. When you have especially grade A acne, that is definitely overkill. Now, if you have sensitive skin where when you're using these acne control products, you did not have red or inflamed skin, but then as you started using a lot of these acne control products, you started to get red, dry, flaky skin, and your skin started to become more red or more splotchy or blotchy, what you can do is, and again, this is for typically grades 1 and 2 acne, where your face is not completely covered with pimples, but just some certain areas, is don't use an acne control cleanser. Instead, use a very gentle cleanser, not a hydrating cleanser, but maybe a balancing cleanser where it's a gel-based cleanser that uses very gentle surfactants, usually coconut-based surfactants, instead of the sulfates that tend to dry out the skin. And then you can use a acne control spot treatment so that you're not using the acne control product all over your face. You're just addressing the very specific spots. Therefore, your sensitive skin is not being exposed to ingredients that it doesn't need. If you have sensitive skin and you have an oil problem, instead of using an acne control mask, think about using a clay-based mask that absorbs the excess oil, that does not have any acne control ingredients in there. And then once you take off the mask, that you put on like a water-based gel hydrator and then put the spot treatment on. Remember, using a spot treatment, that always goes on last after you've used all your other products. Now, grade 2 acne is obviously just a step above. This is where you're gonna have quite a few more pimples or breakouts, and you can still have the whiteheads and the blackheads, but you're gonna have more red bumps or more pustules. Typically, people who have grade 2 acne will have noticeably more oilier areas, typically in the areas of the forehead, the nose, and the chin, and sometimes even the cheek. Males will typically have breakouts all along the jawline here. It's concentrated here. And women, if you have it concentrated here, you're usually under stress. But typically for most women, it's usually focused around the chin area. The significant difference between 1 and 2 is obviously the number of breakouts, but also as you keep going up each grade, there is an increasing amount of more inflammation. And so in grade 2, you'll have a little bit more of the red papules and pustules. And if you have those, benzoyl peroxide tends to help with those a little bit more than the salicylic acid. It's not that I'm saying you don't use salicylic acid, it's that if you actually have more of the red papules and pustules, the benzoyl peroxide tends to respond better to that. You as an individual know, because I understand some people cannot use benzoyl peroxide, they're more sensitive to that, and other people are more sensitive and less tolerant of salicylic acid. But this is as a general rule. Hi, my name is Christy, and I have been professionally treating clients with acne and hyperpigmentation, treating fine lines and wrinkles and other skin conditions for over 12 years. And with the experience of literally doing thousands of treatments on different people, the biggest lesson I have learned is that everyone's skin is a little bit different, and because of that, their response to different ingredients is also varied. If your skin is not sensitive, you're not producing too much oil, and the breakouts that you have are papules or more flesh-colored bumps, but no blackheads, then what you may need is more of a balancing cleanser, because instead of an acne control, because it may be that your skin is not balanced enough and you're producing too much oil, and the fatty acids and sugars that are in your sebum is what is basically feeding the bacteria that causes the acne. So just by simply balancing at that oil and water production in your skin may be just enough to lower the bacteria that causes the acne. And then after you use the balancing cleanser, then you would use a designated exfoliating product. And what I mean by that is, people sometimes get confused with an exfoliating cleanser and a designated exfoliating product. When they use an exfoliating cleanser, they think, okay, so I am using an exfoliator. But when you have the bumps or the existing breakouts, you actually need a little bit more. So when you use the balancing cleanser, then you use an exfoliating product that you can rinse off, especially for sensitive people. When you use an exfoliator that you leave on, such as an exfoliating toner, that tends to sensitize the skin over time, because obviously you're leaving it on. So that's really important if you have sensitive skin, that you use an exfoliating product that you can actually rinse off. You know, use it, let it start to exfoliate your skin, and then you actually rinse it off. Sensitive skin, types would probably do better, and again, it just depends. So the more sensitive your skin is, the less tolerant it's going to be of AHAs and BHAs. So you may want to keep your spot control or your spot treatment to the AHAs/BHAs, and then use an enzyme-based exfoliator that has papain, which is derived from papaya, and or bromelain, which is derived from pineapple. Now, sometimes you'll see scrubs where it still has the enzyme, but it'll also have some salicylic acid in there. And if it is being advertised as an enzyme exfoliating product, like a scrub or something like that, and it has salicylic, then that usually means that it has less salicylic acid than the enzymes, and that might still work for someone who has somewhat sensitive skin. Extremely sensitive skin, I think it's just a trial and error with that. But typically AHAs, for really sensitive skin, AHAs are not suitable. Now, here is one of the downsides of using an enzyme, just an enzyme-based exfoliator. They tend not to work as well as the AHAs and BHAs. So if your skin can tolerate it, even if you can find something combined, just like I said, where it's an enzyme, but it does have salicylic acid in there, or it does have some type of AHA or BHA, that may work a little bit better, because again, if you're using one that's a rinse off, you're just basically applying that and then rinsing it off. You're not leaving it on your skin. And again, this is for people who are more prone to sensitivities. So to sum it all up, typically and generally speaking, if you have acne grades 1 or 2, the ingredients that you want to look for is salicylic acid, glycolic acid. If you have more pustules, the benzoyl peroxide, maybe some retinol. You don't need Retin-A for this. Exfoliating masks, and for those of you who have very sensitive skin, an enzyme-based exfoliant. And most of the time, they're going to be exfoliating scrubs that have the enzyme. Sensitive skin, obviously avoid the ones that have any type of seeds or shells in them, or salts or sugar scrubs. Typically at this level, unless it's extremely stubborn, you don't need Retin-A, you don't need Accutane, and you don't need antibiotics. Simple over-the-counter drugs. It's just finding the right ones and the right combination for you. So if you find that you have grade 1 acne, which is considered very mild acne, focus on balancing out the oil-water production. Sometimes that's all it takes, and then get a spot treatment. I would use, if you have normal to oily skin, maybe a water-based gel moisturizer, such as the hydrating gel treatment right here. And then you can also combine cleansers depending, and again, you have to know the pHs, based on your skin. So for example, if you have mild acne and you tend to have a lot of shine, the first thing that you can do is just try using one that is a balanced cleanser, typically from normal to oily skin. The one that I always recommend for my clients is the Restore Cleanser. This is a gel-based cleanser. There's no sulfates in it, and it does have a very mild amount of salicylic acid in there. If the skin tends to be sometimes oily in some areas, or it is not quite as oily, then I may have them also use, for the first cleanse is the balancing cleanser, and then the second one is the Restore. And so a balancing cleanser would be something like this one here, and that's the Ormetic Gel Balanced Cleanser. Usually when clients use this one, they're surprised because after using it, their skin doesn't feel squeaky clean, which a lot of acne control cleansers will feel like, because of the sulfates that strip the skin and end up having the skin produce more oil. Is their skin will feel a little bit slippery and slimy, which acne clients are not used to feeling this way, so they don't like that feeling. But actually, that is how your skin is supposed to feel after cleansing your skin. So one of the things is, if you have persistently oily skin, sulfate-free cleansers may not do the job for some people, it's a small minority of people, but if we can't get the balancing right and they're just persistently overproducing oil, then what I like to do is I do recommend one that has more of a gentle sulfate. So there's different grades of sulfate that can be more drying or more irritating. So one of the ones that I do recommend is this one here, and this is the Clear Cell Cleanser. This is good for people who have really oilier skin to get that oil off, and then I might, depending on the type of acne that they have, I might follow it up with an exfoliating cleanser. Now this one, I have the professional size, is one that I sell on my website. This one says Refining Jojoba Cleanser, but it is one of the best exfoliating cleansers. Now, as you can see, this is a gel-based cleanser, and it doesn't have, although it has several different ingredients in here, it does have the glycolic acid, it has the salicylic acid, but in addition to the salicylic glycolic, it also has malic acid on here. So if you have extremely sensitive skin, this may not work for you, but someone who has somewhat sensitive skin, I have actually used this on clients who had acne but somewhat sensitive skin, and they were fine with it. So for example, just so that you can see, you see that this is a gel-based cleanser, and when you kind of work it through, I don't know if you can really see, there are some exfoliating beads in there, and these are jojoba esters. So it's not seeds and it's not shell powder. It's just very gentle and it's very environmentally friendly. Okay, so, and then when you feel it, you can feel a little bit of the bumpiness, but because they're beads, they're not sharp. So they're not going to cut into your skin or break open any acne lesions that you may have. Now, because it doesn't have any sulfates in it, even when I add water, you're going to notice it's not going to foam as much as a sulfate-based cleanser. It has some foaming agents, but it's low foam. So okay, so when I rinse it off, although you can't see, it has a very kind of slippery, slimy texture, even though, and see if I kind of work it through, you can kind of still see a little bit of it. It's just a more slippery versus a squeaky clean feel. So here comes the pro tip. If you use a sulfate-based cleanser because your skin is too oily, and 2 hours or less your skin becomes shiny again, then there are two things. One, you're overstripping your skin, or two, because if you have just it doesn't matter what you use, you're producing oil very quickly, then there's a number of things that you have to adjust your ingredients according to the weather, genetics, the food that you're eating, because there are certain foods that actually increase your sebum production, and not only increase sebum production, it actually makes the sebum thicker. So if you don't know anything about that, then check out this video right here on your acne and diet. And remember, makeup is an art, skincare is a science.